The Patient Safety Summits are a really important component of our approach to quality improvement in the Trust. Every day we have thousands of interactions between our patients and all of the clinical staff in the organisation. And sometimes things don't go as we'd like them to. Unexpected things happen or people make mistakes, and we want to make sure that every time that happens we look at what happened and we learn from that to make sure that it doesn't happen again. And the way we do that is we bring clinicians together from all over the Trust to these patient safety summits every week, and we look at every single incident where there's a potential for patient harm to occur. And through the conversation in the room and also through our teleconferencing with the units all around the district, what we want to do is to ensure that everybody involved in those incidents is properly engaged in looking at the incident and learning from it and determining how we can prevent them from happening again. Typically, at one of these weekly meetings, we would have senior leadership, so the medical director and the nurse director who would chair the meeting. We'd also have representation from senior nurses, like deputy chief nurses and the matrons, and from senior medical doctors as well. And we would make sure that all of the divisions in the Trust are represented at the meetings.
We have a safety bulletin that's shared with teams in various modes in terms of in paper and also verbally. So that improves safety for our patients. It also makes us realise when we have never events as to what improvements we need to make in process or safety mechanisms we need to put into place.
As well as the Wednesday Patient Safety Summits, there are daily patient floor meetings held at each of the main sites at Barrow and at Lancaster. And at those meetings there is a multidisciplinary team that look at the current issues at any point in the day. The meetings take place 4 times a day, 3 times a day in general, and they take place every day of the week, so from Monday through to Sunday. If it's necessary or overnight, or if there are site pressures, then there will be an additional meeting at 8 o'clock at night. The meetings are chaired by one of the Gold on call, so that's usually an executive or one of the deputy chief nurses.
The benefit to the patients in the hospital is that if patients are being moved around due to bed pressures or we're looking at patient flow, that we make sure that the right patients are moved into the right bed. It informs us where the pressure is in the hospital, so we know that if there's pressure on surgical beds, we would go and review our patients on surgery, check where they're up to with the discharge plans, and then work with people in the community to try and move the discharges forward, such as social work teams, district nurses, community matrons. I think going to the 12 o'clock meeting really does help solve our problems and move our patients' discharges forward. I know that I can go at 12 o'clock and air a problem in a comfortable environment and supportive environment. I know that if there isn't somebody in the room at the RLI that can answer it, there's probably somebody at Furness General who will come on the telephone because we're on a teleconference with them, and they might have had the same experience down there and shared what happened there. So yeah, it does really help.
We hope that this will result in a stepwise improvement in the quality of services right across the Trust, and we hope this will continue for years to come.
All of these things are what we're doing as an organisation to make sure that we can provide safe and effective care for every patient, every time.